This is a general overview of the skull. We're going to look at different features of the bones that make up the skull and talk about the bones that make up the skull, whether or not they're paired, single, and discuss how they all articulate. First, let's begin with the frontal bone. It's a single bone, makes up solely the superior border of the orbit. The frontal bones come back and articulate with the parietal bones, paired. The parietal bones and the frontal bone, they actually articulate to create what is the coronal suture. It's a fibrous joint. The parietal bones will come together and articulate at the sagittal suture, which is also a fibrous joint. Then coming back, we have the single occipital bone. The occipital bone has a few features you need to know about. This is the occipital bone as it comes all the way around underneath on the base of the skull. The occipital bone will articulate with the parietal bones at the lambdoid suture. The occipital bone is a single bone. The other bones you need to know about, here on the lateral view of the skull, we have the temporal bone, which contains the zygomatic arch. Also on the lateral view, we have the greater wing sphenoid. We have the zygomatic bone. The temporal bone and the zygomatic bone and the greater wing sphenoid are all paired. Then as we look at the anterior view, we'll see the paired maxilla bone here, paired on either side. We have the paired nasal bones. And also we have the paired lacrimal bones. Some features that you need to know about some of these bones. First, let's start here anteriorly. We have the paired maxilla, which houses the upper teeth. We see the opening into the nasal cavity where we see the different concha. What you see here are the inferior and middle concha. The inferior concha being its own bone, and the superior and the middle and the superior concha being part of the ethmoid bone. Also in the middle here, what we see is vomer, and also perpendicular plate of ethmoid. Those two bones combined create the bony nasal septum. So we have the vomer a little bit closer down, and a little bit on the roof of the nasal cavity here, which is the perpendicular plate of ethmoid. The two of them combine to become the bony nasal septum. We look at the superior border of the orbit, solely made up of the frontal bone. On the lateral aspect, we have the zygomatic bone and the frontal bone that make up the lateral border of the orbit. Inferiorly, we have the zygomatic bone and the maxilla bone, which make up the inferior border of the orbit. Lastly, we have the medial orbit, made up of the lacrimal bone, the frontal bone, and part of the maxilla bone, which make up the medial border of the orbit. If we then look at the lateral aspect and discuss a few things that are on the lateral aspect, first we'll look at the three different areas we call the fossas. First we have the temporal fossa, which is simply the area found over the temporal bone. When we talk about the infratemporal fossa, we talk about the area under the temporal fossa, or which would be here underneath the zygomatic arch. So if we can rotate the skull, and you'll see that it would be the area all underneath the zygomatic arch here. Then we talk about the pterygopalatine fossa, and that would be the area in case where I'm showing you with the probe right now. So we have the temporal fossa, infratemporal fossa, and pterygopalatine fossa. Okay? The pterion is also found at this part on the lateral aspect of the skull. It is made up of the temporal bone, the greater wing sphenoid, the frontal and parietal bones all coming together. We know this as the most sensitive part of the skull, and the middle meningeal artery runs behind this area. On the parietal bone itself, we have the faint temporal lines of the parietal bone. They run from mostly the parietal bone and can come onto the frontal bone. This ends up being an attachment point for temporalis muscle, a muscle of mastication. When we look still here at the lateral aspect of the skull, we see the zygomatic arch made from the temporal bone, okay, not the zygomatic bone. Moving posteriorly onto the occipital bone. If we rotate the skull, and you can see this extension here from the posterior aspect of the occipital bone, this is the occipital protuberance. Coming back to the lateral view, some other aspects that we're going to see here. Inferiorly on the temporal bone, we have the mastoid process, we have the styloid process, the external auditory meatus. As we go back towards the anterior view of the skull, we see two different foramen that you need to know about. First one is the supraorbital foramen, okay, and the infraorbital foramen. Both are paired. On the mandible, we know about another foramen in the anterior view. It would be the mental foramen.